You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. On today's episode, I have George Makhoul with me. He is the U.S. CEO for Biom'up. Welcome to the show, George.
Hey, thanks so much for having me. It's great to be here today.
Thank you so much. So if you could, just for our listeners, tell them a little bit about your background and what you've been innovating these days.
Okay, so my name is George Makhoul, and I've been in the healthcare industry for over 20 years. So I've been fortunate enough to have a lot of different roles in sales marketing, marketing leadership, business unit enterprise leadership. And in the last almost 3 years, I've been able to be the CEO of a smaller startup, which has got a disruptive technology in the hemostasis world. And I've been lucky enough to work for some great companies over the years, like Pfizer and Genzyme and Stryker, which have led me to where I am today. And we've really stumbled upon a very unique hemostatic agent called Hemoblast Bellows. And it was approved by the FDA right before 2018. And we commercially launched it in 2019. So we've had a great trajectory in the time that we've launched this. And we are going in a market where there's two very, very large competitors who have had a good stronghold in this area of the market. And we've been fortunate to have something that's highly efficacious, highly differentiated, and something that surgeons tend to gravitate to more once they start using it. So without going too much more into detail on that intro, but it's been a nice run so far.
So thank you for that. So it sounds like you've got just a really strong background in all things commercialization, especially around med device. So I'm really excited to kind of dig into some of your experience today. So as you think about this commercialization process, what, from your perspective, is like the number one, the most important strategy for success?
So when you think about what it takes to do great in this marketplace, there's three characteristics you have to really have, and it's drive, grit, and belief. And when I talk about these things to people, it's really key that these are your innate characteristics that nobody can really train you on. You're born with these. And when I talk about drive, it's, do you get out of bed in the morning and are you inspired to get up and go to work and be excited about what you're doing? If you have that drive every day where you can't fall asleep or you can't wait to get to sleep so you can get to tomorrow, that's a real key thing to have, right? And then you've got to have this grit where, let's just face it, things are not getting any easier in the medical device world for anybody to have success in. It's getting harder. Hospitals want to consolidate less rep access. And now that things have happened with COVID-19, they want fewer people to interact with anyone in the hospital. So you have to have that grit to be there. And with vendor consolidation, there's a lot of large companies out there who have good relationships and good market position. You have to fight them. It takes a lot of grit to do that. But then on top of it is, once you have access and you can get in front of people, you have to demonstrate that belief in what you're doing, what you're promoting is really something that's going to make a difference in either that surgeon, that patient, or that hospital outcome. And that belief comes from within. And if you have that, people will feel that energy from you and they will just want to listen to you and want to try what you have. And those are the things that really, you have to start with that foundation in order to be successful.
You know, it's so true. I mean, those three traits are, I think, fundamental no matter what you're trying to commercialize or sell. I mean, really, ultimately, no matter what you're trying to do in your career, but even more so in healthcare, that it requires a sense of resilience that we might not have to have in other industries if you plan to survive.
Yeah, it's so true. And it's even harder when you're younger in your career and you're trying to get acclimated to this, right? Because things are starting off a lot harder now where there's people who are more veteran in these roles where they have the established relationships, they have the contacts, they understand what it takes to work in these environments. So it's a lot easier for them to navigate the change where someone who's brand new, they're starting with a really really large disadvantage compared to some of their peers that have been doing this for quite some time. So
Yeah.
there's a lot that goes into it.
Yeah, starting off in the COVID world is a whole different dynamic,
Right.
whole different environment. So let's just talk about COVID for a minute. So obviously, I would imagine that things haven't gone exactly like planned when you guys first launched on 2019, 2020, 2021 has been a bit different than anyone could have possibly predicted. And so how has that affected, or has it affected your commercialization and your launch and rollout?
So when you look at it, everything was normal during that time in 2019. You had your offense that you're going to run, you're running the game plan, you're executing on it, things are going great. Then you kick off 2020 and everyone's charged up because the prior year was such a successful launch, and you've got everyone is just full of energy and there's all this wind pushing you forward, right? You've got these great tailwinds. And then January, February, great. And then March hits and all of a sudden things come to a grinding halt very abruptly. And everyone's initially taking in that shock of, okay, let's see where this takes us. There's going to be 2 weeks slowdown. Things aren't going to happen. Then, of course, naturally that gets extended. And then the first time, I think, in history, probably ever, you saw something that was never going to be occurring, which was hospitals were now limiting surgical procedures. I think anybody who's been in the business long enough always said medical device and pharmaceuticals were recession proof, but we never thought we'd have to talk about them being pandemic proof. Right.
Right.
Totally different mindset. So now you're sitting there wondering, okay, we have surgeons who are rotating shifts. They're at home. They're limiting numbers of surgical procedures happening because they want to make sure that there's not too many beds being taken away from the potential need for ICUs needed, right? Now the ORs are becoming makeshift ICUs. Everything is happening real time. Changes are being implemented in place daily. And now everything is just, all bets are off. All trends are out the window. So now you really can't look back at prior history to figure out how this is going to play out. And then, of course, as we've seen from then to now, you learn a lot more about this virus, how it mutates, how it is infected, how it can be prevented, how it can be treated. So things start to change. But one thing that was really interesting that we learned during this was the definition of an elective procedure really changed, right? Prior to, you'd think, okay, elective might be a total knee replacement, or I'm going to get this hernia fixed, or I'm going to have some plastic surgery. They were minor things. But then elective became something that wasn't life-threatening. So in other words, patient needs surgery, but they're not going to terminate if they don't get the surgery soon. So let's delay and let's prioritize who needs to come in. So you have to think about how that changed the whole world, which we could spend hours talking about, right? But from our perspective commercially, and talking to a lot of other CEOs who are in similarly situated businesses like ours, we probably lost somewhere between 6 to 8 months of business, right? The worst of it was in April. May started to rebound a little bit. June got better. July had gone well. And then August, September, through the rest of the year, the trajectory just went straight up. And then you had this second wave. So you kicked off January and February with a slowdown, but the slowdown was more geographic. We saw certain pockets of the country slow down. And then all of a sudden now, speaking for us and other folks, March has just taken off tremendously. So starting to feel really good about where things are going. And as restrictions start to ease, more people become vaccinated, I think we're in a much better place to manage through this process than we were. But during that time, we had to start thinking about, okay, what can we do differently and make sure we're maintaining some relevance. So what we did during that time was we really focused a lot internally on developing our people, working on some different skill sets that they could use some touch and training on. I think anytime you're in a startup environment, you are just hitting the accelerator, and your goal is to go out there and touch as many customers as possible and get the word out about what you're trying to accomplish. Sometimes you don't get to professionally develop your people, and you don't get to do as much of developing your key opinion leaders and other customer targets, right? So we spent time investing in a lot of Zoom videos, several a day internally. And then what else we were doing was offering educational platforms. So we did over 30 educational platforms where we could speak to different types of healthcare providers, about our product, hemostasis, complications of bleeding. And we had a great audience because, as I was alluding to earlier, people were around. They were not working the same shifts and level of hours that they normally would on a day-to-day basis. So we had a great audience and we were able to engage a lot of people. So when things started to open up, it really benefited us. And we hit this like a springboard and really started to achieve a lot of our goals much faster than I thought anybody had anticipated us to do so.
So let me ask you, how is this? Did you already have those established relationships? Because when I hear you describe this strategy, a tactic of educating, kind of in the interim, and still being able to deliver value and build that rapport, build trust. If you're a startup company, you might not always have those connections to be able to get in front of those people. So did you guys already have that in place, or was there something else creatively that you were doing to actually even be able to invite them?
So you think about how you structure these organizations. I think a lot of venture capital, private equity, startup CEOs and operations folks, they always wrestle with how to structure your organization, right? So it's a very similar exercise and discussions that happen in all these boardrooms across the globe. So what do? Do you hire very experienced people and go very direct?
Yeah.
Do you hire experienced commercialization leaders and go this independent route and try to get really good 1099s to help you promote your products? Or do you balance it a hybrid? What we've done here is we put a hybrid together. So there's other people like myself who have been some industry veterans and have experience in this space. Mm-hmm. And they understand these products, these technologies, they understand how to navigate hospitals, they understand what the buying decision process is like. And we have a balance with different 1099 that are our independent distributors. And we've also been fortunate enough too, as well, to have a retired cardiac surgeon on our team. His name is Dr. Bill Spotnitz. He is arguably the most published author on hemostats, sealants, and adhesives. He has over 90 published papers. So there are a tremendous amount of cardiac surgeons who know him well and know his work. But even with that said, you never know all of the potential surgeons and contacts you're trying to reach, but you have that foundation. I think that foundation helps you put together an offense that you can try to work with similar specialties. So did we know everyone that we constantly stayed in touch with? No, but what we did was we used our network. We used the skills from things that we've done in the past to try to help us stay top of mind to all of these other people we wanted to interact with. And that's helped us because there were a lot of people that we were meeting for the first time on meetings. I remember doing a lot of Zoom videos, introducing myself to a lot of surgeons, and I was just happy to listen to them speak and hear their perspectives and gain their insight. So there's always sometimes you can go to the folks that you've known for a long time and you can have really good conversations. So it's striking that balance, and it's not easy, but I think you have to really rely on your network going into this. But if you're in a group where you don't have that strong network, you need to have some type of benefit for them wanting to spend time with you, right? Because if they're going to take 30 minutes to an hour of their time, right? That's taking away from family, patient, you name it. Something else is going to have to give for that. So there needs to be some type of a value add to them, right? What is the hot button that they're thinking about? What is the issue that you can help solve for them? Yeah. And I think once you understand that, now you can really start to get some traction with people.
So George, I want to ask you, I want to kind of switch gears a bit. So you and I were talking earlier, and we were talking about positioning and how we position the innovation being such a critical step to that commercialization process. Talk a little bit about that. How do you define positioning, and how has that impacted your strategy going forward?
So you have to think about this from different angles. And I think anytime you're coming out with a new product or something that's going to be what a hospital would look like as adding cost or adding another SKU to the inventory. Mm-hmm. What are you trying to accomplish? Are you in a commodity line where you want to bring a quality product at a much lower price point to create value? Are you at a unique niche product that's going to solve some type of unmet need where you can demand a premium? Or are you going to have a very good product that can solve needs and it can be competitively priced so that you're not adding to the healthcare system costs, you're finding ways to reduce it, you can create efficiencies, you can do different things. So every company has to wrestle with that when they're going through this, because just getting an FDA approval, depending on whether you're going through a 510K process or we had to go through the PMA, those take significant time, investment, and you're working with FDA. So sometimes your investors don't have the appetite to give you anything else more than the approval of the product, right? They're going to fund you, right? You get the approval. Now you need to go out there and commercialize this, and anything else you want,
Make magic.
Right? That's it. It's done. So it's challenging. We took the pathway where, for us in particular, we wanted to launch with very good clinical data and have a good story to tell, because a lot of times you don't get that. So we actually have 7 published papers in reputable surgery journals that help us to promote outcomes for our product. But even if we didn't have those, just on our characteristics alone, the product is unique enough, right? There's no mixing, no thawing, no refrigeration. It's simple to use. It sticks to tissue, and it works really well. And the FDA indication that the team was able to get is one that no one else has in their labeling. So that alone was really key in the strategy. And I think you have to start putting these things in mind when you're going through your product development stage with your teams of what do you want to be able to say when the product is approved. So if you don't have a single published clinical study when it's launched, what are the claims you want to be able to make? And you have to incorporate those into the R&D pathway. And if you can have that foresight early enough in the process, then you can hit the ground running. Otherwise, you don't want to be in a spot where you're begging people to try this out and see if it works well, right? You want to have a way you can go to people with confidence. And going back to a point you said earlier of, hey, what do you do when you've got the established network? Are you tapping into it? That helps you get an entryway into showing someone new technology.
Yep.
But there isn't a single surgeon on the planet that I know will use a product that is not adequate or inferior if they've got a relationship with you, right? They're not just going to use something because they like you. But what it will do is it will allow you the opportunity.
I might like you, but not that much.
I'm not putting any patient at risk or my outcome at risk, the hospital at risk. There's no way they're going to do that. But we'll give you the opportunity to speak to them and at least have a good dialogue.
So I think that spending just a little bit more time even on the positioning is so important, and I hope that our viewers and listeners, kind of glean onto this. I talk a lot about when I'm working with clients this non-healthcare example of something I think most people can relate to, of just the difference between positioning of like Taco Bell and Chipotle.
Yes.
When you've got 2 companies that are going to play in the same space, but they really don't play in the same space, right? The buyer for Taco Bell is very different than the buyer for Chipotle. And they've thought really long and hard and strategically about how they position those 2, when in some ways you might seem similar products. For other people, it's like, well, no, those are not even close to being similar products. And I think that same approach is just as critical in healthcare when we're talking about this commercialization process, especially for someone like yourself, when you're saying that you're going up against the market of 2 really strong incumbents. And if you don't have clarity on the space that you're going to own and be able to communicate that clearly to your target audience, well, it makes it so much more difficult to actually be able to steal market share from them.
It becomes incredibly challenging because, again, you hit it right on the head, right? Are you somebody who wants to have a race to the bottom and just sell the lowest cost product and move a lot of volume?
Yep.
Or do you want to have something that is reputable, dependable, that you're going to pay an okay price for, but you're comfortable with it because you know you're going to get what you pay for? And that holds true a lot in this industry. And when you talk about sometimes sales folks, they think automatically as soon as someone from purchasing asks them what price it is, they get very nervous and they almost don't want to even say what the price of their true product costs, because they're automatically going to assume that the person's going to tell them it's so expensive, you have to do better. Which is natural, right? Everyone's always trained to ask for a better price, but it doesn't mean your price is high. And I think sometimes a lot of industry folks will get caught up in the fact of, if they have a product that's, let's say, $300 or $400, they might perceive that as being expensive, but they don't realize the person who they're talking to at this moment is signing POs and purchase orders for products that are 5, 10, 15, 20, 100, $300,000 at a time. But they do a great job of making you think that you are ruining the entire budget of the overall healthcare
Right,
system,
right.
right? So you just have to know what you're going into and have confidence in what you're promoting. But it also matters too is who's helping advocate with you. So if it's just you as the industry person advocating, you've got a weaker situation to be into. You need to have that clinician really talk about the benefits of this and champion this for you through the process. Otherwise, then no one's going to believe your story no matter what you tell them, because if there isn't a surgeon champion backing you in this industry, you're really out of luck. Unless you've got something that's commoditized that you can come in there and create a value, or there's some significant change to the process in whatever you're going to be working in the operating room or wherever it may be, that's going to create a major efficiency and it's tangible and recognizable, right?
Yeah,
Hospitals
yeah.
don't, and it's not a knock on the hospital system, they just don't do a good job on measuring the intangible savings that lead to things, right? Like if you
Right.
say, hey, this product is going to reduce your rate of infection, but we don't know what rate that's going to decrease it by, but doing this will inherently reduce that. It's a hard sell unless you have the tangible study, right? And who's investing in that? Very
Right.
few people are doing that. So you have to go through this whole algorithm and process of doing things, but it can be done.
So two other angles that I want to kind of explore with this is, so in healthcare, we're usually talking about multiple stakeholders that are involved in the buying process. And so what are you encountering, and maybe how are you overcoming this when, you've got a hospital system that may be writing the check, and then you've got a surgeon that's actually the user, right, of the tool, and being able to make sure that you're getting buy-in from all of the stakeholders, not just one, because if the surgeon says, yes, they want to use it, can they? And so how is all of that working? And then once you get the sale, what are your experiences when you're trying to actually get adoption for, sometimes we assume that just because a product is better, that it's just going to be so obvious that now it's available, they're just going to start using it. And one of the things that I see with some clients is that, we close the deal, but nobody's actually adopting the solution because they're, kind of still tied to their old habits and old practices or old tools that they've been using. So I know I threw a lot at you, but kind of two levels.
Well, you've got two really interesting scenarios to have. The second scenario is the one that we aspire to get to for us personally as an organization, because we feel once we have things approved, then it's a lot easier for us to find people who will want to use these products. But when you talk about what's going on in that site, you bring up a lot of different instances that happen. So you can pick examples, and I won't mention names of systems, but you'll have this large IDN or large purchasing entity, and they'll have several members that are underneath it. And you'll always have these local hospitals or the one-off hospital inside the system that's willing to bucket and buy something off of the contract because they do believe it's better for their patients. They do have the surgeon champion who wants it. And you can navigate that through. Then you have the other systems that say, look, we only have one vendor in this category and we're not going to deviate. Yeah. Even though they might have something in their compliance that says they only have to purchase 90% of it, there's room for a carve out for something unique or whatever it may be. So you have to understand how to navigate through that process. And you have to keep knocking on different doors in order to find out who is willing to fight hard enough for you to have this in. In other words, have you done a good enough of a job really finding the right champion? Because I think a lot of times what happens to commercial people is that they get fixated on one individual because they have a title and they think they need to get to that person. And they're lukewarm on whether they want to really fight this battle, go to a committee meeting. It's going to cancel, they have to reschedule, they've missed time in their day. To keep going and going through that process, it is exhausting. And it's intentionally done by the systems to see how bad that the surgeons want to push for a product. And they have
sifting process.
And you know this very well. So they know that if they push back on you hard enough, you're eventually going to give up and forget about this new product because you really didn't need it that badly. So you have to do work and find out who is willing to fight that battle. And you have to point blank ask them, look, this is what's going to happen. I know you're aware of this. Are you willing to do this? Because if you're not, we're just not going to have success here in this health system. Some of it's going to come down to they can do their job, but now it's going to come back to you, to the negotiating table. And how creative are you willing to get? Or are you going to stay very rigid into, okay, every hospital gets this price. They can't get this deal unless they do X, Y, and Z. And you have to also be willing to be flexible in how you structure a deal, because every customer purchases differently. Every system operates in a different way. You can have there's large GPOs out there like Health Trust, for example, that do a great job of driving compliance of their contracted vendors. You can find members in that system who will get the best thing they can for their patients. They will do that. And then over time, you'll build up enough demand where you're going to make enough noise that they want to talk to you about a national agreement. So
Yeah.
you're fighting for those things. But you really have to make sure that you're finding the right people to work with you in this process, because it's not just you asking someone to try the product, right? Look, those days have dissipated tremendously where the surgeon would ask for it, the either charge nurse or peri-op coordinator or the supply chain person would order it the next day. Those days almost don't exist anywhere anymore. And we have to be really diligent on how we're doing things and what we're asking for that. And then once you get it in, that's, I think, more than on you as a commercial individual. Okay, now how are you engaging the potential users? Can you get into the hospital and have a reason to be in the operating room? Years ago, you would spend time in the operating room. You'd have a chance to look at the surgical board. You would know who was operating when. You'd run into them and you get a chance to connect. And that's being more restrictive now, especially I think with COVID and having access. So what else are you doing? Do you have a chance to invest in any live labs where they can do demonstrations, cadavers? Are you doing any programs that are of interest for them, right? There's different ways for you to engage your customers and have an opportunity to become invited into their rooms and be there. But it's a lot easier to ask somebody to pull the product and try it on their next case tomorrow than it is to ask them, would you mind championing this through the value analysis committee process for 6 months? They're going to say a lot more yeses to trying it tomorrow when you've already done the legwork in there. So I think if anyone's complaining about not being able to drive adoption, that's the best problem you could have.
You're like, that's a win in my book. Oh my goodness. So what else, kind of thinking about our audience, there's definitely going to be some other chief commercial officers for med device companies, but, there'll be chief innovation officers at hospital systems, as well as just other innovators that are in the trenches. What advice do you have for them going from concept to commercialization?
So involve a lot of different stakeholders. So as you're developing your products and you're thinking about your strategy, bring in people from all different walks. Don't just only limit it to surgeons who are innovators and end users. Bring in people who work in supply chain, people who work in contracting, people who are there in the operating rooms, different charge nurses, different techs, anybody who's going to be, you hate to overuse the word stakeholder, but anyone who's going to have a hand in this product, in this process, get their feedback on how to do it. Because the things you want to think about when you're in these stages, and look, some chief commercial officers, some folks who are in these companies, they're coming into the company to help them grow their business. Everything's already been done, so they can't go back and rewind. But if you have those chances to do that, you want to think about, okay, what are we going to price this at? Well, make sure you've done your homework enough to come in and price it right, because you don't always get a second chance to come to the negotiating table. So if you make somebody upset with you on your pricing, they're not going to welcome you back if you say, hey, we're knocking off 20, 30, 40, 50% now. They're going to say, well, where were you the first time when I was interested, right? You've kind of lost that, right? Don't come to your circulating nurses or your surgical tech or your assistants and say, okay, we can try to make this more efficient for you, but can you at least try to muscle through it now for us? And they're going to say, well, why didn't you ask us ahead of time as you were developing this? Did you not talk to a single person who works in the operating room, right? Talk to other reps who either are in that segment or they're adjacent to it, so they can tell you, look, this is how this works. This is what we do. These are the challenges we face. Understand that, right? But then sometimes you're in a situation where you're brought into a company and everything's already been built for you. So now you have to go out and figure out how to do your job. And that's when you need to get really tight, and you have to set right expectations with people and say, okay, look, this is the segment we think we can capture. We understand you're telling us the market opportunity here is worth $100 million if we had all the market share. But realistically, of the specialties we're going to play in, with what we have today, our market opportunity might be 5 million or 10 million.
Right.
And that's if we maximize that, right? So you want to make sure you're setting the right expectations, because I think many people get enamored with going in and taking big company experience and bringing it to a startup, and they're going to work that offense and it's going to work. It's not always effective, because, when you come in these startups, you don't have that same level of resources. You don't have these massive teams, right? You are the team, right? And whoever else is with you, everyone's taking on every role. And I think you have to make sure that you understand what you're signing up for. But again, it's drive, grit, and belief. If you have those characteristics, it will propel you through this, because you'll find the different pieces of information you uncover.
Yeah, I was working with a client not too long ago who came from Philips, and then decided to go out and start a startup company innovating something, some kind of med device on their own. And wow, just as we worked through that whole commercialization process, it was like, wow, this is so different. I'm used to having a team to go out and do all this stuff for me. I know high level how to do it, but I'm not the one that's been usually executing that. And now I'm a team of 5. And so I'm having to do all of these things that I roll up my sleeve and do all these things that I never had to do before, because I don't have the personnel to rely on, because we just don't have the resources for that. Yeah,
that's right. It's great. You have this idea and they say, okay, well, go ahead, Dr. Roxy. I want you to execute this and get it done. And you're going to say, what? Oh, I need people. And you don't always have that. And I think sometimes people do. But I also think too, the folks who are making the hiring for those roles, they have to do their homework and make sure they're hiring people who have that ability to have a long runway and have those capabilities to do those things. But you're so spot on with that.
Mm-hmm. Yeah. Well, thank you so much for your time today. It's been a great conversation, very invaluable insights to our audience. How can folks get a hold of you if anyone wants to follow up with you after the episode?
So if anyone wants to connect with me, you can reach me on my LinkedIn page. It's not private, so you're able to access me, who I am, and I'm sure they can connect with you. And if they want to get in contact with me, then we'll work something out from that standpoint.
Okay, sounds great. Thank you so much for joining me today, George.
Okay, you have a great rest of the day and great weekend.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.